Afternoon. So I will chime in with the rest of the group, say that it is amazing that this has been possible to get going. I think Frank had done a great job pushing us and getting it organized. And I'm also a little proud of being the only foreigner, I believe, to speak today. So I'm going to try to give you a little bit of a perspective from outside of this country, primarily from Europe. But also some other observations. And how does it now work here?
Sorry.
So first, a brief introduction about myself and the association that I represent. Some data on the world market for hearing aids, some analysis on coverage. Can I do that? Maybe I'll just lean over a little bit then. And some information about the European situation, the delivery models we have, and some analysis of how it works, and then some of the future perspectives that we are seeing. So this is myself at a much younger stage. I am sitting in front of the first so-called mini computer that the company acquired to explore into digital signal processing in 1980. Since then, I served multiple years as head of R&D for the company Dynavox. And then since 1999, when Dynavox was merged with ReSound Corporation, I've been doing a lot of stuff, mostly within IPR, but also maintaining my large network of acquaintances throughout the international hearing care industry. EHIMA is an association that unites the 6 leading hearing aid manufacturers, and they are named here. We believe we provide more than 85% of the world consumption of hearing aids every year. And as you can see, they are located across the world. Starkey here in Minneapolis, Phonak in Switzerland, Siemens in Singapore, although quite a lot of their activity is still in Germany. And then in Denmark, 3 of the other manufacturers, Oticon, ReSound, and Widex, are located. EHIMA is called the European Hearing Instrument Manufacturers Association because most of them are European. It is the sort of group of the 6 big hearing aid companies, so it could be called international for that matter, actually. It's registered in Brussels, and the CEOs meet twice a year and make important decisions and eat good dinners, and then tease each other about current events. The real work is done by the 2 standing committees, the technical committee, that takes care of standardization issues with batteries and all sorts of things. And the Market Development Committee that I'm chairing, where we try to do useful things to make the hearing aid market develop and grow. One of the things we do is to sponsor this website called Hear It. That's a website with neutral, non-commercial information about hearing issues and products. It's translated into 6 major languages and has been operating for 10 years now. So, the world market for hearing aids. In 2012, it was almost 11 million units. Total revenue is around $5 billion, so it's not a huge industry as such. This is wholesale level. The growth is steady and around 2% per year and has been like that for a long time and will probably continue, we believe. And on the different panels there, you can see how it's distributed across the world, with Europe being the major markets sort of area, North America second, Asia Pacific driven by Japan, Australia, China, Korea, and then the rest of the world accounting for 800,000 units. So one of the questions we have been looking at throughout the day, and that we also take some looks at, is how do we figure out how many people in a given country is actually using hearing aids? And I listened to Frank saying some numbers about this early on, and I'm happy that my numbers seem to coincide with those. There are very little objective data to this, and therefore we have developed a model that can be used to at least estimate this. And the only thing we sort of objectively know is how many hearing aid units were sold in a given year in a given country. So let's take a look at some of these major market areas here. We see Europe, USA, Japan, Russia, China, and India being some really large population groups. And you can see the millions of people living there. All of that is pretty objective. Green means objective, and yellow headline means that this is an estimate. We can estimate pretty accurately, though, what is the percentage of the population over 18. And why do we need over 18? That is because we have a number saying that a certain percentage of the population over 18 suffers from hearing loss. And that percentage is 16%. You can debate whether that's the right number or it should be another number. We use the same number for everyone, and therefore it's sort of figures, I guess. So by using those numbers, we can estimate the impaired population of these large countries. And now we need to take a look at the hearing aids sold, and we can find that out. We do some sort of consensus estimate among the members of EHIMA every year. How many hearing aids could we reasonably agree were sold in different countries? And those numbers are shown there as well, in thousands. So in Europe, we sold these 4 million, in the USA, 2.8, and so on. The next important part is to understand how many people got 2 hearing aids and not 1 hearing aids, because you can't say that just because we sold 2.8 million hearing aids, that 2.8 million people got a hearing aid. If some of them got 2 hearing aids, it's less people. Still good for them, they got 2 hearing aids, but it's still less people. So we have to estimate that percentage. There are no accurate figures for it, but we have some pretty good data points there as well. And now we can figure out how many people were, can this actually say? So now we get over here where we can say how many people were fitted in a given year. And now the magic comes, because then we say the typical lifetime of a hearing aid is 5 years. And therefore, if we multiply the number of people fitted with 5 and say that's the number of people owning a hearing aid. This can certainly also be discussed. Is this accurate or not? At least we are doing it the same way everywhere, and most countries that have subsidy for hearing aids say that you can have it renewed after 5 years. When you ask a hearing aid manufacturer how long will a hearing aid last, we will tend to say that if you use it every day, it probably doesn't last much more than 5 years. So that is the number we've chosen, and now we can divide the number of people using hearing aids with the size of the impaired population and come up with a coverage. How large a proportion of the population with a hearing loss is now running around with hearing aids. And as you can see, and maybe this chart is slightly easier to see, Europe and USA are roughly at the same level, around 20%. Japan, somewhat lower, 11, Russia, 7, and China and India just very, very tiny. And I mean, I don't think this is surprising. Maybe some people do, but it's clear that if you live in a developing country and you do get some money, hearing aids are not the first things you think about. You would rather have cell phones, refrigerators, TV sets, and the like. So that thing about hearing aids is coming a little bit down the list of things that you actually would spend your money on. So therefore, we try to do it this way. If you put on the x-axis the gross domestic product per capita for all of these big masses of people, and try to correlate that with the coverage with hearing aids, we now see a pretty good correlation here. As you grow in welfare, you get to higher percentages out here. Except that Japan seems surprisingly low, and Europe seems surprisingly high around that line there. And that is concerning EU, partly because EU is not one country. Here are the 28 different countries of very different sizes and shapes and populations and languages and what have you. Europe is not one country. And here I have done exactly the same calculation that I took you through a minute ago. This is completely impossible to overlook. So therefore, we will turn to the graphical presentation here. Whoop. And now we see the pattern here. I've sorted them according to the coverage percentage. So in the lead, we have Denmark with 55%. And then it falls down to about 30 in Norway. And then there's a bit of a jump down to 20 and falls down here. And there's another jump there. And then it sort of fades off into very low percentages as you get to countries like Lithuania, Latvia, Greece, Slovakia, Romania, and Cyprus, and other places. So this is sort of the big picture of Europe, and the average ends up around 20%. So if we try to map this on a map of Europe, we can see the green countries are those with more than 30% coverage. They are located around the North Sea, up in the northwestern part of Europe. 15 to 20% coverage is primarily the middle Central European countries. Around 10 is the Latin countries, Spain, Italy, Portugal. And then the old East Bloc is running rather low at below 10%. So there seems to be some sort of pattern here. And the differences, why are they so? There are many different explanations. The standard of living or the GDP means something. The subsidy level that the government is offering or insurances are offering means a big difference. The accessibility also means something. The visibility, how apparent is it that you can get hearing aids? And then the historical dimension. Some countries have had free hearing aids for ages. Other countries introduced it recently, and some of them don't even have anything of the sort. So these four different things are what we think defines the difference. So it actually also coincides with the fact that there are four different delivery models, or maybe one strongly different, and then some who are less different. The northwestern one, being the countries United Kingdom, Netherlands, Denmark, Norway, Sweden, and Finland, are characteristic for certain things, and so are the other ones. And let's try to take a look at them. The northwestern model is characterized by public hospitals with audiology departments, and a fair number of them too, offering free hearing aids with good quality for all citizens that has a recognized hearing loss. You simply just have to show up and ask for an appointment, and if they assess that you have a hearing loss, you will be offered a hearing aid. In most of the countries, there is a private dispensing channel alongside with the public, because sometimes the waiting line in the public clinics can be rather long, and some people would then turn to a private opportunity. And the way that private opportunity works is really different from country to country, and it covers from anywhere from 10 to 50% of the total number of hearing aids sold. In the UK, it's a completely private market. If you go to a private dispenser, you have to pay everything yourself. There is no subsidy from the government. In Denmark, you can get a voucher from the government that you can take to a private dispenser, and it will cover the cost of a decent hearing aid. In the Netherlands, you get 75% refund by the public healthcare if you go to a private dispenser. And the typical governance pattern here is that if you do not go to a government clinic, you have to see an ENT who will then say, yes, you have a hearing loss, you will be referred to a private dispensing or a public dispensing unit according to your wish. In the Central European model, it's more insurance-based, but importantly, it is an insurance that you must have. It's not like you can say, I don't want to have insurance. You have insurance. And the insurance will cover some part of it, but not a very large part of it. It will cover 10 to 20% of the best possible hearing aid. The governance system is pretty much the same. You need to see an ENT. He will refer you to a hearing aid dispenser, and he will fit the hearing aid, and you will come back to the dispenser, and he will verify that a decent job was done, and then you can get your insurance money. The South European model is pretty much the same, except that there is not much support at all. You still need to see an ENT if you want to have subsidy, and there are certain groups, particularly challenged people, will get some money. And if you turn to the East European model, there is not much to run for. The governance varies from nothing to some ENT interaction, and it is private dispensing and it's limited. So these are sort of the four different ways it's acting out in Europe. We saw early on that there is some sort of procedure issued here about how to do things when you fit hearing aids. We have a similar thing in Europe where in 2007 some French guys said we need to have a European standard for hearing aid fitting. And it was adopted in 2010, and it sets out standards much in the way we also heard early on education, facilities, equipment you need to have, the fitting process you should carry out, and the quality management system that you should maintain subsequently. It's not intended to cover children, cochlear implants, and other more complicated matters. It is for the usual age-related hearing loss case. It's not mandatory in the sense that it is being implemented, or you must implement it, but if you do pass legislation about these matters, you should comply with this standard. So it's sort of a soft recommendation, or a recommendation that you must abide to. But as I said, Europe is a lot of different countries with a lot of different history and conditions. And if we do the GDP plotting again here now, over Europe, we see again a pretty good correlation between GDP per capita and the coverage with hearing aids, except that up here we have some countries that fall completely off the line, and we have another couple down here that are strange. Norway is mostly strange because they have so much oil that the GDP goes completely over the top. Otherwise they would have been down here somewhere. So that's not so interesting actually. I think the interesting bit is actually this one up here, the green area, where it clearly shows that if you offer people free hearing aids in a reasonable way, they will pick it up, and we also know from other investigations that they do use them just as much as they do in other countries. So the subsidy element here is another, and I just plotted United States here, the purple one here, so it fits there with the German, French, or Belgium level. If you try to estimate the subsidy level in each of these countries, which is not all that easy to do, but I've given it a try. You see also, again, not surprising, that there is a connection. The lower the subsidy is, the less the coverage is, and the higher the subsidy is, generally the higher the coverage is too. Except that some countries fall funnily short. I mean, Finland, what happened in Finland? Well, in Finland, they introduced free hearing aids for the population rather recently. In the other countries, they've had it for ages. And that's the only real explanation I can see. People are simply not educated to pick up the offer. Other people say that's because the Finnish never say anything. I don't think that is necessarily true. They're too busy drinking vodka and stuff. But I think it's also the fact that Finland is a rather large country with a very dispersed population, and some of them are living simply far away from the nearest hearing center, so it might be a complication or so. So why is Denmark now such a wonderful example? Well, I mean, Denmark was the country that introduced free hearing aids for everyone in 1959. So we've been working at this for quite some while. And the clinics have a choice of products, not just one product. They have a choice of products, and generally of good quality, supplied in a tender system. And even in 2000, it was still the leading country in the world with a coverage around 25%. But it was considered to be unsatisfactory that people should wait somewhere between 3 to 8 and sometimes even more months to get an appointment. And to get a refit would take another couple of months to get into the clinic again, and that was seen as unattractive. So therefore it was decided to establish this voucher system where you could go to a private shop instead. You could also take the voucher and you could upgrade to a more sophisticated product if you wanted to pay for it yourself, which a lot of people do. So this caused a lot of private people to establish them with dispensing offices everywhere, and that caused a considerable drain of staff in the public clinics, of course, so their ability to lower the waiting list was not very easy, I would say. it also created a rather large media exposure. People advertised for it. You saw TV commercials, newspapers, inserts everywhere. There was a lot of talk about it. And that might have been part of the explanation, that it actually became something that was apparent to people that you could get a hearing aid. So what happened was that, if you look at this, the total market grew by 80% over 11 years. The public, which is the red bars, went down by 20,000 units, and the private went up. And a recent survey has shown that people, on average, are more happy with the service they get in the private outlets than the service they get at the public clinics. And here the purple circles are all the public clinics, and all the little red dots are where the private shops are located. And as you can see, they're dispersed all over the country, also in little cities where the travel to a big clinic might have been several hours by bus or something. I mean, a lot of retired people are not getting around that easily. So that whole sort of visibility on every high street, shopping streets, you will find hearing aid dispensers also means something to the proliferation of hearing aids. So I think we can conclude here, we think we conclude, that hearing aid coverage is basically a function of standard of living. But a certain level of subsidy clearly increases the coverage, in particular when that subsidy covers a decent basic hearing aid. I'm also tempted to say that in the fact that a government or some other body decides to support hearing aids financially is also an endorsement of the idea of getting one. That should not be underestimated. And then the accessibility and the visibility is also clear that it increases the coverage, that it's seen as sort of common to do these things. You can see it everywhere. You see ads, you see people going in there, and so on. I actually had one slide that we somehow missed, I think. Or I missed. Well, anyhow, you can ask the question, if you believe me when I say that in most countries, people with severe and profound hearing losses have a relatively high percentage coverage for that group of people because they have a serious problem. Where the growth is then going to come from is from the moderate and the mild hearing losses, which actually means that some people are going to buy hearing aids with more moderate losses, and they will walk around with these, and they will, I mean, not to sort of discriminate against anybody, they will appear as pretty ordinary people with their hearing aids and make other people think that, I mean, they are just like you and me, and therefore it will reduce the stigma to have more people use them, and you will not get that feeling that it's something special. This is not evidence or science. It's just my personal reflections on what we've seen happening here. So I think it has accelerated in Denmark partly because you see more people with hearing aids and you think they look kind of okay with it. Also, they have become much nicer to, I mean, visually, cosmetically, they are much, much nicer today than they were 10 years ago. So that's another factor. So all that sounds really nice, but unfortunately, it doesn't appear to be quite that nice in the future, because the cost of this is, of course, not to be underestimated. And in some of the countries, we are seeing this pushback from both insurance companies and public systems that they think it's expensive, and what they call the age burden of the aging population is going to be very costly. And at the same time, the hearing aids are getting better every year and more attractive, so more and more people want to have them. This is an equation that is not easy to solve. So we will see reductions in the subsidies and some increased price pressure, we think. We will also, and that was what we just heard recently, that the price package, the price of the package you get could also be differentiated. I mean, it's clear that somebody who brings in a 5-year-old child with serious hearing loss is requiring a lot more attention and service than some middle-aged man who went hunting too much and has the need for a hearing aid. I mean, he will pick that up pretty quickly, I think. Why should that cost the same? And also, as it was said, the fact that the whole service charge is transported into that little piece of plastic that is the hearing aid is in some ways unfair. This is a delicate matter, and I know that most dispensing communities are a bit sort of shaky about this whole discussion, and that's fair enough. I just think it is inevitable that it's going to come up someday that we need to work with that dimension. And the last part is that people will have somehow to figure out that if they take care of dental work and their spectacles, they will have to pay some part of their hearing stuff as well. But still, some degree of subsidy will clearly improve people's likelihood to go for it. So those were my words on this. Thank you.